of World Hypertension Day, I have some message and awareness regarding the increasing incidence of hypertension for the general public or for the patient who having hypertension. So normally now we are seeing in worldwide, also in India, the increasing incidence of hypertension will be more and more. And the concern is present is that the young generation people will now suffer a lot in hypertension, that is young age hypertension. And maybe it's starting maybe 20, 25 and 30 age, the increase of incidence will be more and more. So for the common public, I have some message in context of like how we'll know the hypertension, or how we know the blood pressure is increases, and if it increase or it is high blood pressure, then what we will do, and after that what we have to the treatment part, the diagnosis, management, and prevention, and further if any problem will be happen, how we will manage. Normally, we are seeing if there are some symptoms like we have profuse sweating, if headache, and wrinkling of head. So then we may think that we have high blood pressure and we have to consult the nearest hospital or clinic to any physician or doctor. So then we have to go to clinic and we check our blood pressure. And if blood pressure will be normal, then it will be no problem. And it will be high. Normally we will see if more than 140/80, then we can tell it is a hypertension. Normally the treatment, two parts are there. One is non-medicated management and one is medicated management. Non-medication, mostly the important for lifestyle modification, because now we are seeing the lifestyle is one of the most commonest factor for the increasing incidence of hypertension. So the number one is food. In food, we have to reduce the salt intake or restricted our salt intake, number one. Number two, very important is the food. In food, we have to avoid junk food or street food. So basically, we have to more focus on our homemade food, so that the preservative and the storage food we have to avoid. It will one of the cause of hypertension. Number three is addiction. In addiction, now the young age, more and more alcohol and tobacco. Tobacco is one of the most common cause of hypertension. So we have to avoid the smoking and tobacco in form of gutka or whatever, and the alcohol. So these are the food and the addiction. And third part in lifestyle, the very important part is the activity, because nowadays we are seeing more and more restrictive or sedentary lifestyle. So to further prevent all the things, all the diseases related to our sedentary lifestyle, so we'll have to start minimum either walking or any yoga or pranayam or any form of physical activity, to mild go to gym, so that our activity increases, then we may prevent hypertension. And next thing is, after in lifestyle modification, other than the food and the activity, the most important thing is stress and anxiety. In young age people, we are now seeing the more and more stress and anxiety. After COVID, it will be increasing more and more, so that we are seeing the hypertension incidence will be increasing. So to reduce the stress and anxiety, you have to more social, and any form of your whatever you there is no fixed things to reduce your stress anxiety, but it depends upon the person to person how you will control your stress or anxiety. These are the non-medicated part or lifestyle modification part. If we go for medication, there are many drugs or many medicine which will prevent hypertension. According to the physician and doctor, according to your disease pattern, we have to choose the medication and we have to take. So my strict advice is, if you have the medication, take regularly, don't skip, don't omit without any consultation or advice.